Video we are going to see regarding cirrhosis of liver. Cirrhosis of liver, as it is a kind of a chronic disease. If we see about the introductory aspect of it, in which there will be diffuse destruction and there will be fibrotic regeneration of the liver cells. So as the necrotic tissue in cases here is replaced with the fibrotic tissue, the normal liver structure and vasculature that would be altered, and that impairs the blood as well as the lymph flow. So this results in two condition, one that is portal hypertension and the second one that it causes hepatic insufficiency. Clear? Definition wise, if we go, cirrhosis of liver, it is a chronic progressive disease when that is characterized by widespread fibrosis and scar formations or scarring as well as nodule formation. The development, it is insidious, prolonged course, and it develops after decades of chronic liver disease. Cirrhosis, it is, you can say that it is the consequence of a chronic liver disease, and that is characterized where there is replacement of the liver tissues by fibrosis by scar tissues and regenerative nodules to the loss of liver function. Incidence, if we see about 20% of the patients with chronic HCV and 10 to 20% of the patients with chronic HBV tend to develop cirrhosis. Classification of cirrhotic of liver. First thing, that is alcoholic cirrhosis. Alcoholic cirrhosis, the other name for it is called as the Leniak's cirrhosis, micronodular cirrhosis, or called as the portal cirrhosis. Here, men are more likely to develop alcoholic cirrhosis. Fibrosis occurs, that too particularly around the central veins and the portal areas in cases of alcoholic cirrhosis. Now, this is associated with chronic alcohol abuse, as the name suggests, and small nodules that are formed here. This are as a result of some offending agents. Second type of it is called as the post-necrotic cirrhosis. Post-necrotic cirrhosis, the other name of it is micronodular, or also you can call it as the toxin-induced cirrhosis. Here it is the most commonest form of cirrhosis of liver which is seen worldwide, and here one can see that is broad bands of scar tissues. It is caused by post-acute viral B and C hepatitis and post-intoxication with industrial chemicals, and this is more common in cases of females. Third type, that is biliary cirrhosis. Here in cases of biliary cirrhosis, the scars that would be formed around the bile ducts and around the lobes of liver. It results from the chronic biliary injury and obstruction of the intrahepatic or the extrahepatic biliary system. Here, primary biliary cirrhosis and primary biliary cirrhosis and primary sclerosing cholangitis. These are the biliary causes of cirrhosis. And the another type, that is called as the cardiogenic cirrhosis. Now it is a rare form of cirrhosis of liver, and this, you can say, as the name suggests, that it is a chronic liver disease that is associated with the long-term right-sided heart failure, and it is caused by either AV valve disease, constrictive pericarditis, and like conditions. Etiology and risk factors is the next point that we are going to see. It involves chronic viral infections of the liver, fatty liver if it is associated with obesity and diabetes. Alcohol abuse is again a cause, primary biliary cirrhosis, primary sclerosing cholangitis, biliary atresia, cystic fibrosis, hemochromatosis, Wilson's disease, Budd-Chiari syndrome, galactosemia, or you can also call it as the glycogen storage disease, autoimmune hepatitis, Ehlers syndrome, certain medications like acetaminophen, infections, even infections like syphilis can cause it, and one more, that is amyloidosis. So these are the risk factors as well as the etiological factors. Pathology or the pathophysiology in case of cirrhosis of liver is that because of any of the above discussed etiological factor, there will be diffuse destruction and regeneration of the liver cells. So this will lead to the formation of fibrous tissue. Fibrous tissue, or rather the destroyed liver cells, that would be gradually replaced by scar tissues, fibrotic tissue, and that would yield fibrosis, cirrhosis, leading to damaged liver tissue. Furthermore, it causes the obstruction of blood, lymph, and bile. So all of this in turn will cause hepatic insufficiency. Clinical manifestation, there are early manifestation as well as late manifestation along with the certain systemic involvement. So early manifestation is very insidious. Early symptom is fatigue, followed by late symptoms, and that may be severe. It may result from liver failure and portal hypertension that involves jaundice, ascites, peripheral edema. All of this develops gradually. Other late symptoms also develop, and that include certain symptoms like skin lesions, hematological disorders, endocrine disturbances, peripheral neuropathies, etc. Let's move further towards the systemic manifestation, and that involves, first of all, neurological. That involves hepatic encephalopathy, peripheral encephalopathy, and asterexis. GI symptoms, that involves anorexia, dyspepsia, nausea, vomiting, change in bowel habits, dull abdominal pain, gastritis, hematemesis. Also, there is a symptom that is called as fetor hepaticus, which is called as this breath of the dead. Now, this there is here in this particular symptom, there is breath with strong musty smell, and it is just a sign that the liver is having trouble filtering toxic substances. So, usually in cases of severe liver disease, as a result of sulfur that ends up in the bloodstream and it reaches to the lungs, so it is called as the breath of the dead. And the last symptoms regarding the GI manifestations is hemorrhoidal varices. Let's move further towards the reproductive manifestations. Here it can cause amenorrhea, testicular atrophy, gynecomastia, impotence, loss of axillary and pubic hair, and vaginal bleeding. Next is integumentary system that involves jaundice, spider angioma, or you can call as the spider nevis, that is very common in cases of alcoholic cirrhosis. Next is palmar erythema or liver palms, whatever, either or. Purpura, caput medusae. Caput medusae, that is due to severe portal hypertension and petechia. Next is about the metabolic part. Metabolic, it causes hypokalemia, hyponatremia, and hypoalbuminemia. Hematological manifestations, again it involves anemia, thrombocytopenia, leukopenia, coagulation disorders, and splenomegaly. Cardiovascular manifestations, there will be fluid retention, peripheral edema, and ascites. Diagnosis part, in cases of, one thing I'm missing over here, that is about the complications that I need to discuss prior to diagnostic evaluation. So let's see about the complications first. Okay, so complications that involves, there will be decrease in the amount of sodium, so that is hyponatremia, and that leads to water retention, correct? There is bleeding, esophageal varices, coagulopathies are developing, spontaneous bacterial peritonitis, and hepatic encephalopathy. Hepatic encephalopathy, which may be precipitated by use of sedatives, high protein diet, sepsis, or electrolyte imbalance. So that is about the complication part. And now moving further with the diagnostic evaluation. So very good diagnosis that involves proper history taking. Right. So history followed with the physical examination. You will find out all the liver function tests to be elevated. There will be rise in AST, ALT, GGT, and ALP, increase in the amount of serum bilirubin. Liver ultrasound, that is to assess the severity of cirrhosis. Liver biopsy to identify the liver cell changes and alteration in the lobular structures. Also, prothrombin time that would be prolonged. CBC and serum electrolytes as a mode of diagnostic tests. Upper endoscopy, CT, there will be decrease in the amount of cholesterol levels, and that is due to abnormal fat metabolism. Paracentesis, that is to examine the ascitic fluid for cell, protein, or bacterial count. And PTC, that is percutaneous transhepatic cholangiography. So that is about the diagnostic aspect. And management, minimize the further deterioration of the liver damage, and that is through withdrawal of the toxic substance. Alcohol and drugs is the first line of management, so that also is followed with the collection of the nutrient deficiencies, and that is through vitamins, nutrition supplements, and high calorie to moderate to high protein diet. Treatment that is important, and that is of the ascites or fluid retention due to an electrolyte imbalance. One should restrict sodium and water intake, and that depends upon the amount of fluid retention. Patient is said to have bed rest that would aid in diuretics. Diuretic therapy. Diuretic therapy, it is frequently with spironolactone. It is a potassium sparing diuretic, and that inhibits the action of aldosterone on kidneys. Also, there is Lasix that can be given. Furosemide is commonly given, which is a loop diuretic, and also can be used in conjunction with spironolactone to help balance the potassium depletion. Abdominal paracentesis, and that is to remove the fluid and to relieve the symptoms. Administration of albumin, and that is to maintain the osmotic pressure. Tips, that is trans yeah, tips. So tips, that is transjugular intrahepatic portosystemic shunt, and it is an interventional radiological procedure that can be performed in the patients of ascites which are resistant to other forms of treatment. And this tips, that is percutaneously created connection within the liver, and that connection is between the portal and the systemic circulation. A shunt here is placed, that is to reduce the portal pressure in the patient with complications related to portal hypertension. So that is about the procedure, how to do the what is the basic principle behind tips. So that is all for cirrhosis of liver. Thank you for watching and hope it proves useful to you.